Hello everyone, welcome back to my YouTube channel. In this video today we'll be discussing about the Norma occipitalis. The word norma means an aspect, talking about the aspect of skull. Which aspect are we discussing today? Occipitalis. Occiput means the back of the head, so we are discussing about the occipital portion of the skull. So let's get started. This is the posterior view of skull. What are the bones present in the Norma occipitalis? It is the posterior part of the two parietal bones. Next is the mastoid part of the temporal bone. After that is the squamous part of the occipital bone. Talking about the sutures which are seen, it is the posterior part of the sagittal suture, the lambdoid suture present between the parietal and the occipital bone, parieto-mastoid suture present between the parietal and the mastoid bone. Next is the occipito-mastoid suture present between the occipital and the mastoid bone. After that, the parietal foramen. See, the parietal foramen is seen between the two sagittal suture. A point in between the two parietal foramen is known as obelion, which is considered as the representative of the third eye. The point of meeting of the sagittal and the lambdoid suture is known as lambda. In the midline, there is a prominence seen over the squamous part of the occipital bone, which is known as the external occipital protuberance. On each side of the external occipital protuberance, two curved lines run medial to lateral, okay, with their concavity facing downwards, which are known as the superior nuchal line. The line running below the occipital protuberance is known as the inferior nuchal line. Sometimes the superior nuchal line actually gives attachment to the trapezius muscle. Okay, so it is the origin of the superior nuchal line. Sometimes another line runs above and parallel to the superior nuchal line, which is known as the highest nuchal line. The external occipital protuberance, it is present in the external surface of the occipital bone in midline, and its most prominent part is known as anion, which gives attachment to the ligament nuchae. So, just above anion, there is occipital point, which is the farthest point from the glabella, okay, anteroposteriorly. Glabella, which is the point between the two superciliary arches we have seen in Norma frontalis. So anteroposteriorly, farthest point or the farthest measurement of the skull is between this occipital point and glabella. Now, sometimes what happens at the apex of the squamous occipital bone, a small piece of bone known as the interparietal bone is seen. It is the membranous part of the occipital bone which fails to fuse with the cartilaginous part of the occipital bone. The mastoid foramen is seen in the mastoid bone, which actually opens into the this foramen, mastoid foramen, it opens into the sigmoid sulcus. Okay, interiorly. The mastoid foramen carries emissary vein and the meningeal branch of the occipital artery. So this is it about the Norma occipitalis. Do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss any latest updates. Let me know in the comment section below if this video has helped you in any ways, as this would boost me to make videos of even better versions of for you all. Stay tuned, keep visiting. Thank you.